Heart disease can refer to a variety of conditions, such as irregular heartbeat, plaque buildup in the heart's blood vessels, defects in the heart structure, and heart failure. Heart failure occurs when the heart is weak and cannot pump blood effectively, but with proper treatment, many people can survive a heart attack. So, what are some common causes of heart failure? The most common causes include a heart attack, high blood pressure, and diseased heart muscle. Some less common causes include heart valve disease, infection of the heart muscle, abnormal heart rhythm, excessive alcohol consumption, anemia, chemotherapy for cancer, high blood pressure in the vessels that supply blood to your lungs, and protein buildup in the heart and other organs. When it comes to managing heart failure, paying attention to your salt intake is important. Sodium, which is found naturally in foods and added to processed foods, helps maintain a normal fluid balance in your body. By limiting the amount of salt you eat, you can reduce the extra fluid around your heart, lungs, and legs. This extra fluid can make your heart work harder and worsen your symptoms. It's best to consult with your doctor to determine the right amount of sodium for your specific condition, as the recommended limit can range from 1,500 to 2,000 milligrams per day. It's important to talk to your doctor about how much water you should be drinking each day, especially if you are taking diuretics. Drinking too much water can still strain your heart, even if you are trying to replace the fluid being removed by the medication. To help cut back on your water intake, consider using smaller cups, spreading out your water consumption throughout the day, trying hot or cold beverages, sucking on ice cubes, and limiting your caffeine intake. So, can you still drink alcohol if you have heart failure? The answer is yes, unless your heart failure was first caused by drinking too much. But be sure not to overdo it. It's important to stay within recommended limits, which means no more than 1 daily drink for women and 2 for men. Before you get behind the wheel, it's important to check with your doctor to make sure it's safe for you to drive. If you drive for a living, it's a good idea to also talk to your employer about any laws or regulations that may apply to your situation. If your symptoms of heart failure are stable, you should not have any problems during a flight. However, some people may need extra oxygen while flying. If this applies to you, it's a good idea to check with your airline beforehand to understand their policies. If you have a pacemaker, make sure to inform airport staff when going through security, although neither air travel nor security machines will affect your device. To stay comfortable during the flight, try stretching and moving around. Your doctor may also recommend wearing compression socks to prevent blood clots. If you're considering traveling to high altitudes, talk to your doctor first. The lower oxygen levels at higher altitudes can put more strain on your heart, and your medications may need to be adjusted or it may not be safe to go at all. It's important to talk to your doctor before engaging in sexual activity if you have heart failure. Sex can be considered a form of exercise, so it's best to wait if you've recently had surgery or if your heart failure is severe. If you're unable to have sex, it's still safe to show affection in other ways, such as through touching and kissing. It's also normal to experience changes in your relationships and a decreased interest in sex due to the stress of heart failure. You may also experience sexual side effects from medications. Don't hesitate to discuss these concerns with your healthcare team. They can provide resources such as sexual counseling to help address these issues. When it comes to managing heart failure, physical activity can be really beneficial. It can help to strengthen your heart, improve blood circulation, and increase your body's ability to use oxygen. However, it's important to talk to your doctor before starting any new exercise routine, as they can advise you on what activities are safe for you. Starting slowly and taking breaks when needed is key, and it's important to pay attention to any signs that you might be pushing yourself too hard, such as feeling short of breath, dizzy, or experiencing a very fast heart rate. Walking is a great way to start, but activities like swimming and stationary cycling can also be good options. Always listen to your body and take it at your own pace. If you notice any mental changes like confusion or memory loss, it's important to talk to your doctor. Keep an eye out for symptoms such as shortness of breath, feeling unusually tired, a faster heart rate, sudden weight gain, swelling in your feet and legs, or changes in your appetite or sleep. These could be signs of heart failure and should be discussed with your healthcare provider.